Hello, everyone. Thank you for joining us today. This program is brought to you by Regional Dairy Specialists with Cornell Cooperative Extension. Today, we will be discussing critical calf care, decision-making for urgent dairy calf health situations. This is episode 6, where we will cover emergency situations for your calf. This is the 6th episode in a 7-part series. If this is the first portion of the series you are viewing, we hope you will tune into our other sessions as well. Recordings will be posted on the Northwest New York Team YouTube channel. As a reminder, this content has been approved by the National Milk Producers Federation, FARM team, as continuing education. Add your participation in this program to your records for your next animal care audit. Today's presenters are Betsy Hicks with the South Central Dairy and Field Crops team, and myself, Alycia Drwencke, with the Southwest New York Dairy, Livestock, and Field Crops team. Before we jump in, we do want to remind everyone that we are not veterinarians and the materials presented are for educational purposes only. We strongly encourage all farms to have a veterinary client-patient relationship and that you consult your veterinarian as the need arises. In this specific episode, we will cover how you know it's an emergency situation, euthanasia decisions, 2 different case studies, and considerations for disease outbreaks. So starting off, let's discuss how we know it's an emergency situation. While some situations are extremely obvious that they are an emergency or that they require drastic attention quickly, other situations or ailments can be less obvious. This can include incidences that may require additional monitoring or testing to fully understand the severity of the situation. Additionally, some situations may not be presenting as an emergency right away, but if not addressed quickly, they may result in one. To help you determine the severity of this situation, you can utilize many of the behavioral and physiological indicators we've discussed in other episodes of this series, such as hydration, posture, isolation, health scores, vigor scores, etc. It's important if you believe your calf may be having an issue to perform an assessment of their physical and behavioral status to look for any sort of signs of concern. As you are assessing the physical and behavioral indicators of your calf, you should also look for signs of distress. These signs can include increased respiration rate and heart rate, increased body temperature, or the presence of paddling and thrashing in the calf, or if a calf is non-ambulatory. I want to take a moment to highlight that according to the 2014 NOM survey, 95% of pre-weaned calf mortality on dairy farms in the United States occurred without euthanasia or assistance. This is a big concern and a huge opportunity for improvement within the industry to promote better welfare and improve consumer perceptions. When faced with emergency situations, it should be acknowledged that sometimes the best thing for the calf is to perform euthanasia. When this occurs, only trained personnel should make that decision and carry out the procedure. It's important to not overlook the stress and the toll that this does take on humans involved with the euthanasia procedure. And finally, euthanasia should be timely and must be done with an AVMA-approved method or a method in accordance with regulations specific to your country if you're outside of the United States. If you're unsure of what method to use, please consult your veterinarian. According to the 2020 AVMA guidelines, there are 3 approved methods for euthanasia in calves. The first one being IV administration of a lethal dose of barbiturates, the second being gunshot using an appropriate firearm, and third being a non-penetrating captive bolt. There are resources available to help you make euthanasia decisions and to train your personnel, including those from the American Association of Bovine Practitioners. And we will drop some links in the chat to this resource as well as several others. Your farm may want to consider establishing a euthanasia decision tree or some sort of strict SOP that lays out incidences of when a calf should be euthanized immediately versus treated and reevaluated. You can break this down into time points if it's helpful for your farm. This can include time points such as calves at birth, sick calves, or calves with a traumatic injury. Our team has put together an example of this that you can either utilize on your farm or adapt as necessary. And we'll go ahead and drop a link to that in the chat. So looking at that first time point of calves at birth, we have established a few different criteria that you can look at. So calves that have an injury or lameness, calves that have been vigor scored and have either scored marginal or poor vitality, calves with a vitamin deficiency, or calves born with birth defects. And there's two different paths that can occur. One that leads to immediate euthanasia, and then one that leads to calves being treated and reevaluated. And I want to emphasize that reevaluate piece. Calves that are being treated should be consistently reevaluated, and at reevaluation, it should be determined if the calf is improving or if their status has deteriorated. If a calf's prognosis has gotten worse, or if they are suffering, at that time, calves should be immediately euthanized. This next example walks you through some different situations for sick calves, including ones that are off feeder water, calves showing signs of infection or disease, or calves that are non-ambulatory. And again, your two options are to either euthanize immediately or treat and reevaluate the calf. And finally, our example has laid out some incidences of calves with traumatic injury. Implementing a strict SOP or a decision tree can help farms make timely euthanasia decisions and stick to them. Additionally, it can help alleviate some of the stress and pressure of decision-making when a struggling calf or injured calf is present on the farm. So if you've joined us in previous sessions, you know that we have laid out some chat questions to help you reflect on your farm, as well as offer some opportunity for interaction. So our first chat question of today is, do you have a plan or an SOP for determining euthanasia on your farm? And responses can be, no, we don't have a plan. 2, we make decisions spur of the moment. 3, we have a verbal understanding but no written plan. 4, we have a written plan for our lactating herd but not our calves. And 5, we have a written plan that we train employees on for euthanizing calves. And at this point, I would like to pass it over to Betsy Hicks to walk us through our case studies.
Thanks, Alycia. So we're going to walk through 2 different case studies today. So we'll start with case study 1. So our patient is a 10-day-old Holstein heifer calf. So 3 days ago, her appetite disappeared and she has had to be tubed several times to be fed. So you do a good job with records. You looked up the records on her and you saw that she had to be pulled at birth, and the person pulling her ranked the dystocia a 3 out of 5. So you have been monitoring her. She has had very watery scours, her eyes are very sunk in, and she's had a fever over 103 for the last 2 days. Initially, you were using electrolytes and it seemed to help her hydration status. Now, though, she's not responding to those hydration tactics, even after administering IV fluids. This calf really looks like she is not going to make it, and death seems imminent. What do you do? So that brings us to chat question 2, and this is a simple 1 or 2. Would you, 1, continue to treat this calf, or 2, perform timely euthanasia? So when we look at this case study, this poor little heifer calf, prognosis with this calf really isn't all that great. So it's decision time. So likely she is suffering from a rotavirus or a rotocoronavirus. You can refer to the disease progression timelines from webinar 1 to refresh your memory. We know that hydration tactics, like what we talked about in webinar 4, those aren't working. So guidelines from this webinar indicate she should be euthanized to avoid more suffering and a painful death. And I'm just going to read this quote because this paper really talks about euthanasia, and I'll just read it. The way an animal dies is an important aspect of its welfare. Assuring a humane end is the ethically responsible thing to do, regardless of whether the animal is a rat, a dog, or a cow. Involuntary euthanasia is not only permissible for suffering animals, but indeed obligatory. Uncontrollable pain and suffering offers justification for euthanasia that is easier for most to accept. We really have to be okay with deciding that euthanasia is the best thing for this animal. So let's move on to case study 2 and talk about our patient. So this patient is a 4-month-old Jersey heifer. So unfortunately, this girl experienced a broken leg at 3 months of age about a month ago, but your vet and the herdsman deemed that it was appropriate to treat and cast that leg when she was evaluated. Initial reevaluations seemed promising, but lately she doesn't appear to be making progress. She has lost a lot of weight. She has a really rough hair coat. She isn't eating well, and she really isn't competing with the others in the pen. She's fallen behind in growth, and she does not interact with other calves. So, chat question 3, decision time. What would you do with this calf? Drop a 1 in if you'd continue to treat this calf and reevaluate at certain time points, or choice 2, perform timely euthanasia. And so with this girl, her prognosis says that her recovery does not look good and her quality of life has been greatly diminished. On top of this, we know that economics are a factor. A tough decision has to be made, even though considerable time, money, and emotion from the handlers has been allocated to try to save her. So the correct option in this case for this farm would be to euthanize this heifer. And so here's another quote for us to look at. So despite knowing that euthanasia may be the most humane choice for an animal, electing and performing euthanasia can cause animal caretakers and owners to experience moral stress, particularly for those who work daily to keep the animals under their care alive and well. Caretakers tend to animals daily, and sometimes they may view euthanasia as a failure in their ability to provide adequate care, making it emotionally tasking in both arriving at the decision and performing the procedure. Often caretakers may avoid euthanasia of animals in need because they sincerely are hoping that the animal may heal and recover, not because they want the animal to suffer. I think this quote in this paper really brings the crux of the situation to us that care about animals so deeply. But we need to make sure that we take care of ourselves in making this decision because it is the right thing for the animal in certain situations. So we're going to move into another subject. We're going to move into disease outbreaks. And so some risk factors for disease outbreaks include exposure to older animals, inadequate or damp bedding, poor ventilation, overcrowding, poor cleanliness, calves that received inadequate colostrum at birth, and calves that haven't received adequate nutrient intake either. We can also talk about infection sources, so places that these calves can get infected. They can be feces from normal adult cows into shared housing, and also calves that are non-immune shedders. Pathogens can be aerosol or in the air. These tend to cause respiratory disease. And then occasionally water, feeding utensils, rodents, birds, pets, or people can be the transmission of infection for these calves. Usually when we look at the onset of disease, if a disease occurs within 5 days of birth, the infection source was the dam or the calving environment. After that 7 days of age, generally the infection source is from that calf's environment. So with disease outbreaks, knowing the pathogen is key to controlling the outbreak. So there's a whole list of pathogens here that can cause diarrhea, and there's a whole other list of pathogens on the right that can cause pneumonia. Knowing which one of these you're dealing with is absolutely key to controlling a disease outbreak. If you do suspect that you have a disease outbreak and lots of calves are getting sick, it's important to know where to get testing done. So first and foremost, work with your veterinarian. Many of them have the abilities in their clinics to identify pathogens, and they can help you identify strategies to mitigate the issues involved. The Cornell University Vet School has their Animal Health Diagnostic Center, and they do accept samples for testing. We'll drop this link in the chat for you to access and keep in mind. They test for a lot of different pathogens, and they also offer this vet-to-vet consult. So with the disease outbreaks, we want to stop the spread. First and foremost is cleanliness. Cleanliness from your boots to your clothing, changing both of those. If you've been working around adult cows, the minute you cross into working with calves, change those. We also need to know that some pathogens are infectious to humans. So wearing gloves and avoiding touching your face, and again, changing clothes, those things are all super important to keep yourself as a human safe. We're going to avoid using common pails, bottles, and nipples when we're dealing especially with a disease outbreak. And we're going to clean and disinfect our utensils and feeding tools between feedings and or sick calves. Absolutely, undercrowding, keeping good ventilation, and lots of ample dry bedding under calves is key to stopping the spread and keeping calves that aren't experiencing any infection, keeping them healthy. And just reiterating, prevention is key. The better we do at keeping everybody healthy, the less disease that we will experience. With disease outbreaks, we do also have to think about mass euthanasia or mass mortality. So in the case where mass mortality occurs or we have to euthanize a population of calves, absolutely contact your farm's veterinarian. They can help you with either euthanizing these calves or helping you work through a plan of what to do with the carcasses. You may also want to work with your state veterinarian to determine this plan. This plan should include options for a timely carcass disposal of these calves or animals, including cremation, rendering, and remember, only render if they're euthanized by non-barbiturate means, or composting. Definitely, though, this last thing, remember the hazards for your health and safety, as well as the health and safety of the other animals and people involved. Lastly, I'm going to bring up this necropsy option. So a lot of veterinarians offer necropsy services to help you determine a cause of death. Farmers can also perform a necropsy to gather information or gather samples for further testing. The Colorado State has an awesome resource for walking through a dairy cow or dairy calf necropsy. This manual, we'll drop this link into the chat as well. It's an awesome manual to reference back to. You can do a full necropsy or just portions of necropsy to get to the samples that you want to see. All right, so to wrap up, we have put together some key considerations for this webinar. So first off, calves should be monitored and evaluated for emergency health situations. Secondly, timely euthanasia may be the best option for the welfare of the calf. AVMA guidelines should be followed when euthanizing, and most importantly, check in on the mental health of the humans making the euthanasia decisions. So this is the ending slide for our webinar 6. We want to invite you to join us for the next session on February 16th. This is our hour-long live panel discussion. You can join using the same Zoom link that you used to access this webinar. And at this point, we would like to invite you to submit any questions to us using the Q&A feature. Thanks so much.
Right now, we don't have any questions in the Q&A, but if you have any questions, feel free to put them in at this moment. Or if you have maybe any other ideas. I know this is a difficult topic to speak about, and we will have plenty of time next week with our live panel to discuss any questions with them that you have. But if you have any questions for us this week, please feel free to enter them now.
And Betsy has kindly put in the link to the recordings. So if you missed any of our other sessions, definitely check those out as well.
So I just want to pop in real quick, and I love that we had so many people responding to the chat questions today. There was a lot of differences in opinions, which are completely fine. This time to go over these case studies was, it's something that is just written on the page. We see it on this video screen, and it's very different than being in front of this calf. Alycia and I, when we were putting together this set of webinars, or this series, this particular webinar, thank you. We wanted to actually make both case studies be a euthanasia in the end, because it is very difficult. And referring back to the statistic that Alycia shared, not enough calves are actually actively euthanized. More deaths occur than should be that should have been euthanized deaths. So we just wanted to really pull attention to that. And we can put together some stats for the responses, but I don't know if that's the important part. I think the important part is realizing that, your farm might be very different from the neighbor's farm. Having a plan for euthanasia for your farm is the key, and working through those difficult scenarios with the other people on your farm or with your veterinarian, or both. Those are going to be key for, coming up with the best plan to try and take some of the emotion out of it. We're all animal lovers. Euthanasia is really difficult. So that's all I wanted to say about that. Anybody else want to chime in about that?
No, I think that's super well said, Betsy. Thanks for bringing that up. Seeing no questions or comments coming in, please feel free to email us if you have a question that you just didn't want answered live, or if you have a question for our panelists next week. We hope to see you there. It will be February 16th, starting again at 12:30, and that session will be a 1-hour session. So if you have questions that you want addressed, please email those to us, and we hope to see you there, and hope that you will give us your feedback in the survey. And see you then. Thank you.